Hello everyone, welcome to physioBRAIN. This is Professor Adriano, and today we're going to be talking about acute viral bronchiolitis, right? We're entering the winter season when respiratory conditions are very common, so stay with us because we're going to talk about that today. So you already know, don't forget to subscribe to the channel, like the video, and share it with anyone you think needs to know this information. So, acute viral bronchiolitis, what is the definition of this condition? How can we explain it? It is a respiratory condition that affects children, especially babies, up to 2 years old, right? In the United States, it is estimated that approximately 20% of children born each year may develop some type of respiratory infection, usually viral, and that their diagnosis will likely be acute viral bronchiolitis. Okay, just so you have an idea, the estimated annual costs related to this disease can reach close to $2 billion per year for the care and healthcare services for these children. So it is extremely important that we are knowledgeable about it, right? What is very common to observe is that children, especially during the winter months when it gets colder, develop this type of respiratory condition, viral bronchiolitis, which is caused by a viral infection. So, some pathogens, some pathological agent, which can be some type of virus, but the most common virus responsible for this disease is the Respiratory Syncytial Virus. Okay, so this virus is responsible for the majority of cases of acute viral bronchiolitis, right? So the signs and symptoms, it is very common for us to observe, right? An exacerbated cough, right? We may notice fever, respiratory discomfort. If you haven't watched our video, we have a video where we talk about the signs of pneumonia in children, in which bronchiolitis can start a process of respiratory discomfort and acute respiratory illness, right? That can lead to or turn into pneumonia later on. So we can observe this, and we have to be very careful, right, with the children we know, to stay alert to the signs and symptoms, because if we identify the symptoms, the initial prognosis, right, the outcome later on is usually much better, all right? So acute viral bronchiolitis occurs especially, right, in the bronchioles. So it's in the more, let's say, internal part of our lungs, right? So it doesn't happen in the main bronchi, but rather in the bronchioles and the smaller areas where these bronchioles become overloaded with mucus, with secretions, right? So this is what causes the child's difficulty in breathing. So we need to be very attentive so that we can take the child to a healthcare facility as soon as possible, all right? So the respiratory syncytial virus is the main cause. Acute viral bronchiolitis mainly affects children from 0 to 2 years old, right? It happens mostly in the winter, and we need to be very careful to make the proper referral whenever necessary, all right? Do you have any questions or suggestions? Write them here in the comments. Share the video with anyone you think needs to know this information, and I'll see you in the next videos.